Welcome to Healthcare Provider. Today we're talking about a common yet often misunderstood condition, Irritable Bowel Syndrome, or IBS. Whether you're dealing with symptoms or just curious about it, this video will break down what IBS is, its symptoms, common triggers, and most importantly, how to manage it. 1. What is IBS? IBS, or Irritable Bowel Syndrome, is a functional gastrointestinal disorder. It affects the large intestine and is characterized by a group of symptoms. But what's key is that it doesn't cause any physical damage to the digestive system. IBS is quite common, affecting up to 15% of people globally. IBS causes the muscles in the bowel to contract either too much or too little, resulting in symptoms like cramping, bloating, gas, and changes in bowel habits. 2. Common symptoms of IBS. IBS can vary from person to person, but the most common symptoms include 1. Abdominal pain or cramping. This is usually relieved after a bowel movement. 2. Bloating and gas. A feeling of fullness or pressure in the abdomen. 3. Diarrhea, constipation, or both. IBS can cause frequent loose stools and frequent hard stools, or alternate between the two. 4. Changes in stool appearance. This might include mucus in stools or changes in stool consistency. Symptoms can flare up after certain meals, during times of stress, or even seemingly without cause. 3. What causes IBS? The exact cause of IBS isn't fully understood, but it's believed to be linked to a disrupted connection between the brain and the gut. Some factors that may play a role include 1. Stress. Mental health plays a big part in IBS, as stress can worsen symptoms. 2. Gut microbiome. Changes or imbalances in the gut bacteria may be a contributing factor. 3. Dietary triggers. Certain foods can trigger symptoms in people with IBS. 4. Hormonal changes. Women with IBS often report more symptoms around their menstrual cycle, suggesting a hormonal link. 4. Common triggers for IBS. IBS symptoms can be triggered by several factors. Identifying and avoiding your triggers is a key part of managing IBS. Some common triggers include 1. Certain foods. Fatty or fried foods, dairy, artificial sweeteners, caffeine, and alcohol. 2. Stress and anxiety. Emotional stress can make the gut more sensitive. 3. Large meals. Eating too much at once can trigger cramping and bloating. 4. Lack of sleep. Poor sleep can make symptoms worse. Remember, not everyone has the same triggers. What causes symptoms in one person might not affect another, so it's important to keep track of your own reactions. 5. Diagnosing IBS. Diagnosing IBS can be tricky because there's no specific test for it. Doctors typically diagnose it based on symptoms and by ruling out other conditions. Your doctor might ask for blood tests, stool samples, or even recommend a colonoscopy to ensure that your symptoms aren't caused by something else like inflammatory bowel disease or celiac disease. 6. Managing IBS. Managing IBS usually involves a combination of lifestyle changes, dietary adjustments, and sometimes medications. Here are some effective ways to control symptoms. 1. Dietary changes. A low FODMAP diet is often recommended for IBS. FODMAPs are a group of sugars that can be difficult to digest for some people. By avoiding foods high in FODMAPs, many people experience relief from symptoms. 2. Stress management. Since stress can trigger symptoms, it's important to manage stress through methods like meditation, yoga, deep breathing, or even counseling. 3. Regular exercise. Physical activity can help keep your digestive system moving and reduce stress. 4. Medications. For some, over-the-counter remedies like fiber supplements or medications that reduce bowel spasms may help. In more severe cases, a doctor might prescribe medications that affect the gut-brain connection. Making these changes can help reduce the frequency and severity of IBS symptoms, but it may take some time and experimentation to find what works best for you. 7. Hope for the future. Living with IBS can be frustrating, but with the right tools and support, it's possible to manage your symptoms and lead a full, healthy life. If you think you might have IBS, talk to your doctor and work together on a plan that suits you. Thank you for watching. If you found this video helpful, please give it a thumbs up subscribe to our channel, and don't forget to hit the bell for notifications. If you have any questions or would like to share your experience with IBS, leave a comment below. Stay healthy and see you in the next video.